Welcome back to The Wellness Effect. Don't forget to subscribe to our channel and hit that notification bell so you don't miss out on any of our insightful discussions. In this episode, we are joined by Dr. Samuel Fourie, an expert in the field of oncology, as we discuss breast cancer and the management options available to those affected by it. Welcome, Dr. Fourie.
Thank you, Seth, for having me.
It's a pleasure. I'm really looking forward to this discussion. Dr. Fourie, what are the primary management options for breast cancer treatment?
So traditionally, we have 5 modalities that can be utilized for breast cancer treatment. Firstly, surgery. That's an operation that could be done. And that could be either limited surgery, just removing the lump or the growth itself, or it could be more extensive, like a mastectomy, where you remove the whole breast. With that, you could either remove some of the lymph nodes underneath the arm, or you could just remove one, which is called the sentinel node biopsy, just to see if there is any cancer in the lymph node itself. Then we also have options like the chemotherapy,
Sure.
radiation, targeted therapies, which is the newer treatment options, and then hormonal therapy.
Dr. Fourie, you've been in the field of oncology even before I was born. And I wanted to find out from you, between men and women, what are the typical cancers that you note?
Yes, so the most common cancers in women would be breast cancer, but also cervical cancer. And then we see the other cancers like lung cancer and gastrointestinal colon cancer and so on. Men, obviously, we see the most common cancer would be prostate cancer and lung cancer, and then the colorectal cancers.
I know there are different stages in cancer. So what are the different treatment options available at each stage? Or do you go straight to chemotherapy, or are there alternative methods to really attack the cancer?
Yes, so when we decide about treating a breast cancer patient, we have to look at specific factors. So the most important factor that we look at is the type of breast cancer. So over the years, we've learned that there are different subtypes of breast cancer, and each one has got its own personality or behavior and the way that we would expect it to behave, but also its own treatment. So we know, for example, that some cancers, some breast cancers specifically need chemotherapy, but others don't. So the type of cancer is the most important determinant in the type of treatment that you would utilize. But then also, as you just mentioned, stage would be important. So for an early stage cancer, the aim of treatment would be cure, and to also keep the patient in remission long term, so that the patient has a long-term outcome of the cancer not coming back. That's what we would like to achieve. And for that, we utilize a combination of all these treatment options that I've mentioned, so depending on the type of cancer. Whilst with stage 4 disease, where the cancer has already spread and is more advanced, the aim of the treatment would be different. It would, in some cases, be aimed at alleviating symptoms, because the cancer can cause significant discomfort or pain, and treatment would be aimed at alleviating those, and then also to get as best possible long-term survival and outcome in the long run.
And what are the different, so there's targeted treatments. How do they differ from, your traditional treatment options?
Yes, so when they started analyzing these breast cancer cells and found that there are different subtypes.
Yes.
They also found that these specific subtypes of cancers might have a specific property or characteristic that could be targeted. For example, 1 out of 5 breast cancer patients have a specific oncogene present, which is called HER2. And many drugs have been developed that would target that specific oncogene in the cells. So So it's like a key in a lock analogy. So you could have a key that only fits that specific lock, and these drugs only target those specific cells. They can
Interesting.
only bind to those cells and not to other cells in the body. So that's the whole concept of targeted therapies,
Hmm.
and which we use a lot nowadays in oncology, but also in breast cancer.
Hmm.
So we can have these drugs that will target the HER2, but in the newer data, we also have the option of targeting the immune system for
Okay.
a small group of breast cancers, where giving the patients immunotherapy can then target the immune system and switch it on, and the immune system will then uh, target and destroy the cancer cells. So that's another form of targeted therapy that we can utilize.
Hmm. That's incredible. How important is clinical research in improving breast cancer management options?
Oh, clinical research is extremely important, and without clinical research, we would not be where we are now. Huge progress has been made in the management and outcome of breast cancer patients over the last 30 to 50 years, and that's all due to clinical research. We are actively involved in clinical research ourselves, and many centers in the country would be involved with that. And the the principle is that utilizing the current research that we're involved in would impact on our children and your children going
Hmm.
forward, and will have a huge impact on them. Like with the current patients already have the benefit of the research that's been
Hmm.
done 20 years ago.
That's amazing. Yeah, in conversations we were having, you mentioned that you do note some patients that come into your practice not wanting to go through the chemotherapy route and maybe focusing on traditional methods or unconventional traditional methods, let's call it that. Are you noting that there is a stigma and fear around chemotherapy?
So it's important to realize that chemotherapy today is not the same as it was 20 years or 30 years ago.
Hmm.
We have newer agents available, and more importantly, we have better supportive medication that makes the side effects of chemotherapy much, much less and much more tolerable than it used to be.
Hmm.
So my most common experience with patients would be that they would be very apprehensive about chemotherapy.
Yeah.
But once they started with it and they've gone through it, they tell me, but it's not as bad as they thought,
Oh, wow.
and that it's very tolerable, and that they'd be happy to continue and finish. And
Hmm.
if you understand the benefit that it can bring,
Correct.
not only now, but in the long term, then it's often very easier, much easier for patients to manage that.
And maybe let's talk through prevention. What are some preventative measures that our viewers can incorporate into their lifestyle to almost prevent it?
Yeah, so that is a very contentious topic
Yeah.
often. It has been shown that lifestyle changes can make a difference in your chances of developing cancer. So there are certain things that you can do to prevent cancer from happening in your life. Certain things you can't change, like your
Mm.
genes and the environment where you live in. But the things that you can change can make a big difference, and that would include exercise. In other words, a lifestyle of being active and regularly exercising, but also a healthy diet,
Mm.
um, staying away from unhealthy foods like junk food and all of those things that we know. Like we teach our little children what they should eat. If we do the same, then often it will make a difference in
Yeah.
our chances of
Yeah.
long-term reduction in cancer risk.
Mm. I wanted to touch on treatment options that don't require chemotherapy. Could you maybe elaborate a little bit more on that?
So firstly, radiation treatment. So radiation treatment is basically using high energy X-rays, and that is also developed significantly over the last 20, 30 years. New technology has made a big difference, like we've seen in our lives, normal lives as well, and all the technology and the advances in technology that we've experienced. The same has happened with radiotherapy, and it's become much better at targeting the area that you want to target in the patient, and not causing any collateral damage in the patient. So radiation can also make a big difference in breast cancer, and it can also help patients retain their breast so they don't have to have a full mastectomy, and can make a big difference in the symptoms of the cancer.
Mm.
And the other option that I just mentioned briefly was a hormonal treatment.
Yes.
So often, many breast cancers are driven by the female hormones like estrogen, and they are overexpressing estrogen and progesterone receptors in the breast cancer cells. And that's another way of targeting those cancer cells, because if you can block that effect, you actually take away the driver and the stimulus for the cancer cells to grow.
Sure.
And that can make a big difference. And it's an easy treatment often, which might just entail taking a tablet once a day. And it can make a big difference in the long-term outcome of these patients.
And with the rise of artificial intelligence, are you seeing any of those technologies influencing oncology practices?
Not directly at the moment. Where I think it's gonna make a difference is in teasing out further subgroups of breast cancers and developing new, more targeted agents in treating these cancers. The DNA and genetic makeup of the cancer cells can be better analyzed, and I think we will see progress, which will be assisted by AI
Amazing.
and other new technologies, but it's still going to take a bit of time, because any new development still needs to go through
Testing.
process and
Yes.
testing and so on. Yes.
Okay. So, Dr. Fourie, why is there this trend now of not operating directly on, the breast cancer patients and going towards more alternative options?
Right in the beginning, when many years ago, the initial thought was that if you can cut away as much as possible, you have the best outcome. Many years ago, patients would end up with actually mutilating extensive surgery, and it made no real impact on the outcome of the breast cancer patients. And so over time, they realized that breast cancer is a complex disease, and that just cutting it out doesn't always cure the patient,
Correct.
and that you need comprehensive treatment with multiple modalities, which would include options like chemotherapy, radiation, targeted therapies. And over time, we also realized that it's often better in specific subgroups of breast cancer patients to start off with these treatments, see how the patient is responding, and then at a later stage utilize surgery. And often these patients respond so well that you can do very limited surgery, very less invasive surgery, and sometimes even not surgery at all.
Oh, amazing.
But that is still very early days in terms of research. But the trend has been that patients then end up with much less surgery than they would have had years ago.
So thank you so much, Dr. Fourie, for your time and for sharing such practical steps and insights into breast cancer treatment options.
It's really been a pleasure. Thank you for having me.
And thank you for watching. Remember to subscribe and hit that notification bell so you can catch every episode of The Wellness Effect. See you next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.